24-year-old male. Seizures since 3 years of age. Sudden onset of tingling, followed by jerking of the right arm, then partial motor seizures on the right side of the face, and blinking of the right eye. Consciousness is intact during the whole event. Neuroexamination. Right hemiparesis with strength grade 2 in the right hand. Preoperative imaging for brain tumor. It is important to observe veins, sulci, and other special details. The extent of the tumor, entry point to the tumor, the shape of the tumor, the boundaries of the tumor, medial, posterior, anterior, superior, and inferior. The differentiation between gray matter versus white matter versus tumor. Preoperative MRI. Here we can see an axial cut, and we can see the omega sign, but this omega sign belongs to the post-central gyrus. The motor omega sign is over here, and it is occupied by the tumor, and this is the superior frontal sulcus. In this cut, we can see that more or less at the anterior limit of the tumor there is a vein, and also approximately over the posterior limit of the tumor is going to be another vein here. So by observing the veins during the surgery, I can tell the anterior and the posterior limits of the tumor. And another question I have here is a sagittal cut. Another question that I have is, how deep can I go? How do I know when to stop the resection? How deep can I go? So if we compare to this sulcus and to this one, especially this one, you see at the bottom, once at the bottom of the sulcus, I have to go a few millimeters deeper in order to remove completely the lesion. So in this cut, where is the tumor? This is anatomical dissection, and this is the cingulate sulcus. We follow cingulate sulcus, and this is the marginal ramus. As we know, marginal ramus will intercept in 100% of the cases the postcentral gyrus. So if this is a postcentral gyrus, this is a postcentral sulcus, this is a central sulcus, the tumor is located over this area. And here we have the anatomical correlation of the MRI. So we know that the tumor is located in this area. And here is the positioning of the patient. This is the intraoperative photograph of this case after the craniotomy and the dural opening. So we have here the midlines over here, and this is the left side, and this is the left post-central gyrus. So we can see the yellowish tumor over here. Apparently it presents good limit to separate the tumor from the normal brain tissue. And see that first vein, the most anteriorly located, and then the second vein that we could see on the MRI. And here we were performing the cortical stimulation to determine the functional motor area. And here was the motor area for hand in this area, away from, it's close but away from the tumor. So now we have the video here, and we can see the exposure after the dural opening. Once again, here is the postcentral gyrus, and here was the place, the area where we could get response with the term the hand area, motor area for the hand is over here. Let's go to the video. So the initial step is to open the arachnoid membrane to separate the tumor from the normal brain tissue. And I'm opening the central sulcus over here. And by doing a subepithelial dissection, I am keeping the arachnoid of the central sulcus intact. So everything, all the veins and arteries running inside the sulcus would be preserved. And now I'm debulking the center of the tumor. So luckily the tumor is very different. It's easy to differentiate from the normal brain tissue. So very careful, this area was the motor area for the hand. The tumor is easily suckable and is very different from the normal brain tissue. So how deep can I go? So this is the bottom of the central sulcus. I have to go few millimeters deeper until the normal white matter is reached. The same thing for this area. So once we reach the bottom of the sulcus, you have to go a little bit more deeper. On the left, we have the intraoperative photograph before the tumor removal. Post-central gyrus, motor area for the hand after the cortical stimulation. And on the right, we have the intraoperative photograph after the tumor removal. And this is the post-op MRI performed 1 year after the surgery. The surgery was performed in 2008, and this MRI was performed 1 year later, showing the gross total resection of the tumor. The histology showed DNET. He became seizure-free after the surgery in 2008. The strength of his right hand improved to grade 4. And this is the post-op MRI performed 7 years after the surgery, showing no recurrence of the tumor.